Hello everyone, and welcome back to the channel. In today's video, you will learn about 11 common signs of diabetes in women. Diabetes is a chronic metabolic disorder that affects millions of people worldwide, and women in particular may experience unique symptoms that can often go unnoticed or be mistaken for other health issues. According to the International Diabetes Federation, approximately 200 million women globally are living with diabetes, a figure projected to rise significantly in the coming decades. While diabetes manifests differently, depending on individual factors, certain symptoms are more prevalent in women. Recognizing these signs early can help facilitate timely diagnosis and treatment, reducing the risk of long-term health complications. In this video, we will explore the 11 most common signs of diabetes in women to help you recognize the warning signs and seek timely medical intervention. One of the earliest and most common signs of diabetes is frequent urination, medically termed polyuria. When blood glucose levels rise above normal thresholds, typically exceeding 180 milligrams per delia, the kidneys struggle to reabsorb all the excess sugar back into the bloodstream. As a result, glucose spills over into the urine, drawing water with it through osmosis. This process increases urine production, causing the individual to urinate more frequently than usual. Study shows that hyperglycemia directly contributes to polyuria in diabetic patients. Women may notice waking up multiple times during the night to urinate or needing to use the restroom more frequently throughout the day. Initially, this symptom might be dismissed as a minor inconvenience or attributed to other benign causes like drinking too much water or consuming caffeine. However, if frequent urination persists without any clear explanation, it could signal underlying diabetes. For women, especially those who experience this symptom alongside others mentioned in this video, seeking medical evaluation is crucial for ruling out diabetes. Another common sign of diabetes in women is excessive thirst, medically termed polydipsia. It often accompanies frequent urination due to dehydration caused by fluid loss. As the body loses fluids through excessive urination, it signals the brain to increase water intake, leading to persistent thirst. The body's natural response to low hydration levels is to trigger thirst signals, prompting the individual to drink more water. However, in cases of undiagnosed diabetes, no amount of water seems sufficient because the underlying issue lies in elevated blood sugar rather than mere dehydration. For women, experiencing unusual dry mouth or constant cravings for liquids despite adequate hydration, this could be an early warning sign of diabetes. It's important to note that while occasional thirst is normal, especially after physical activity or in hot weather, persistent and unquenchable thirst should not be ignored. Sudden and unexplained weight loss despite eating normally is a red flag for diabetes, especially type 1 diabetes. This occurs when the body is unable to use glucose for energy due to insulin resistance or deficiency. Instead, it begins breaking down fat and muscle for fuel, leading to rapid and unintended weight loss. Studies show that losing more than 10 pounds in a short period without trying can be a significant indicator of diabetes. If left unmanaged, severe weight loss can lead to muscle weakness and malnutrition. Over time, the breakdown of muscle tissue can lead to fatigue, reduced strength, and an increased risk of falls and injuries. For women, unexplained weight loss can be alarming, especially if it happens rapidly. It's important to differentiate this from intentional weight loss through diet or exercise. If you are losing weight without trying, it could be a sign that your body is not properly utilizing glucose, and you should consider talking to your healthcare provider. Another common sign of diabetes in women is excessive hunger. Excessive hunger, medically termed polyphagia, arises from the same mechanism as weight loss. It occurs due to the body's inability to effectively utilize glucose for energy. Despite eating regularly, women with diabetes may experience constant hunger. This occurs because the body's cells are unable to access glucose for energy, leaving them starved and signaling the brain to eat more. This condition, known as polyphagia, can lead to overeating and further blood sugar spikes. Many women may experience cravings for sugary foods, which can further spike blood sugar levels and worsen insulin resistance. If this cycle is not controlled, it can contribute to excessive calorie intake and weight gain, which complicates diabetes management. In some cases, this increased appetite can lead to binge eating or emotional eating, making it even more difficult to maintain a healthy weight and stable glucose levels. If you experience unexplained hunger even after eating, it is important that you check your blood sugar and consider talking to your doctor. Fatigue is one of the most commonly reported yet underappreciated symptoms of diabetes. Persistently high blood sugar levels impair mitochondrial function and limit glucose from entering the cells to provide energy. This results in the body feeling exhausted even after adequate rest. Additionally, poor sleep quality stemming from frequent urination in the night exacerbates daytime fatigue. This fatigue can be debilitating, affecting daily activities and overall quality of life. This type of fatigue is often accompanied by mood swings, irritability, and brain fog, making it challenging to maintain productivity and overall well-being. Furthermore, extreme fatigue can also impact mental health, leading to symptoms of depression, anxiety, and a decreased quality of life. If you find yourself feeling unusually tired despite getting enough sleep, it may be worth investigating your blood sugar levels. Yet another sign of diabetes is blurred vision. It is one of the early symptoms of diabetes. High blood sugar levels can cause the lens of the eye to swell, leading to blurred vision. This symptom is often temporary and can improve with proper blood sugar management. However, if left untreated, diabetes can also damage the blood vessels in the retina, potentially causing long-term vision problems such as diabetic retinopathy, a leading cause of blindness. Women with diabetes may notice that their vision fluctuates throughout the day, especially after meals when blood sugar levels are higher. If you experience sudden changes in vision, it's important to consult a healthcare professional to monitor any vision changes and prevent long-term damage to the optic nerves. Without proper treatment, blurred vision can progress to total vision loss. Impaired wound healing is a well-documented complication of diabetes. Elevated blood sugar interferes with collagen synthesis and immune cell function, delaying the repair process. Furthermore, nerve damage reduces sensation, making it easier to overlook minor injuries until they become infected. High blood sugar levels damage blood vessels and reduce oxygen delivery to tissues, making it difficult for the body to repair itself efficiently. Women may notice that minor cuts, bruises, or skin injuries take longer to heal than usual. Additionally, untreated wounds can lead to infections or ulcers, particularly in the lower extremities, which increases the risk of severe complications like amputations in advanced cases. If left unchecked, slow-healing wounds can become a breeding ground for bacteria, increasing the likelihood of life-threatening infections like gangrene. Proper foot care and regular monitoring are essential for women with diabetes to prevent these complications. Women with diabetes are more prone to urinary tract infections, yeast infections, and skin infections. High blood sugar levels create an ideal environment for bacteria and fungi to thrive, leading to recurrent infections. In particular, yeast infections, which is caused by candida, can result in persistent vaginal itching, burning, and discomfort. Urinary tract infections may present with symptoms like painful urination, increased urgency, and lower abdominal pain. Additionally, diabetes can weaken the immune system, making it harder for the body to fight off these infections. If left untreated, these infections can become more severe and spread to other areas of the body. Infections in women with diabetes can also be more difficult to treat, requiring longer courses of antibiotics and a greater risk of antibiotic resistance. If you experience frequent infections, it's important to discuss this with your healthcare provider. Prolonged high blood sugar levels can damage nerves, resulting in diabetic neuropathy. This condition causes tingling, numbness, burning, or pain, especially in the hands and feet. Women may initially experience mild sensations, but as nerve damage progresses, it can lead to loss of sensation, making it difficult to detect injuries or infections. Neuropathy can also lead to muscle weakness, reduced reflexes, and an increased likelihood of developing foot ulcers and infections. If you experience these sensations, particularly in your hands and feet, please reach out to your healthcare provider for proper examination. Managing blood sugar levels through medication, diet, and lifestyle modifications is key to preventing or minimizing nerve damage. Acanthosis nigricans is a condition where dark, velvety patches appear on the neck, armpits, groin, and other skin folds. It is often associated with insulin resistance and is considered an early indicator of prediabetes or type 2 diabetes. Women may notice these patches gradually developing and becoming more pronounced over time. The affected areas may feel thickened or rough and sometimes have an odor. While acanthosis nigricans itself is not harmful, it serves as an important warning sign of underlying metabolic issues that require medical attention. This condition can also cause cosmetic concerns, leading to self-consciousness and a negative impact on self-esteem. If you notice darkened skin patches, it's important to seek medical advice to assess your risk of diabetes. Diabetes and hormonal imbalances often go hand in hand, particularly in women with polycystic ovary syndrome. Polycystic ovary syndrome is closely linked to insulin resistance, which can exacerbate menstrual irregularities, infertility, and other reproductive health issues. Women with diabetes, particularly those with insulin resistance, are more likely to experience menstrual irregularities and polycystic ovary syndrome. Symptoms include irregular periods, heavy bleeding, and fertility issues. Menstrual irregularities can also be accompanied by other symptoms such as weight gain, acne, and excessive hair growth. Women experiencing missed periods, heavy bleeding, or difficulty conceiving should consider diabetes as a potential contributing factor. Proper management of blood sugar levels can improve polycystic ovary syndrome symptoms and restore regular menstruation. If you experience these symptoms, it's important to consult a healthcare provider for a comprehensive evaluation to prevent long-term complications. Diabetes is more than just a medical condition. It's a silent disruptor that can quietly infiltrate every aspect of a woman's life, from her energy levels and mental clarity to her reproductive health and overall well-being. The 11 signs mentioned in this video are not mere isolated symptoms. They are interconnected warning signals, each offering a glimpse into the body's struggle to cope with elevated blood sugar levels. Recognizing these symptoms early can help you seek timely medical intervention and lifestyle modifications. The good news is that diabetes, whether type 1 or type 2, is manageable and in some cases preventable. By adopting healthier lifestyle habits, such as regular physical activity, balanced nutrition, and stress management, women can significantly reduce their risk of developing diabetes or better manage an existing diagnosis. If you experience multiple symptoms from this list, it is advisable to consult a healthcare provider for testing and proper management. And that's it for this video. If you find this video helpful, give me a thumbs up and consider subscribing to get updates when I post a video like this. Until next time, goodbye.